Hello, Innervets. Today I'm gonna show you how to fold and make a surgery drape. In this case, we usually put our surgery drapes in a sterile folder, which is the one that I have in my hands right now. But every clinic is different. Your clinic might store them in another place. But as you can see here, I'm stretching the drape, and I usually use the length of the table to use it as a guide, but that also depends on your veterinarian preference. If they want it, if they want to make it longer or shorter, I would recommend for you to ask them. And then after I cut, I just grab one layer of the drape and I stretch it out. And I'm gonna switch views over here so I can show you a better angle of the folding process. But basically, you're gonna stretch it out like that. And then you grab one of the layers, and that you're gonna fold it to the middle of your drape. And then you're gonna take the corners to the edge of your drape, and you're gonna repeat the process with the other side. So corners to the middle, and then corners to the outside edge, and then you're gonna fold it inwards like that. And then you're gonna fold the other side the same way, so inwards, and then you're gonna grab that middle and fold it on top. So now you have a straight line, and you're gonna mark the middle of the drape so you can fold it in half, and that middle is gonna be your end point. So fold it in half, end point, and then that's gonna be your middle of the drape. So you grab it over there and fold it. There are some drapes that are just easier to use because they actually mark very easily when you fold them, but this one that we're using is very slippery, I would say. I don't know how to describe it. It's just the texture. It doesn't stay folded even if you fold it. So it just depends on which one you're using. But now we're putting the drape inside the sterile folder or packet, and this one, as you can see, was a little bit too long, but we were able to close it anyway. And now again, it's the clinic's preference, but what we do is write down surgery drape and our initials and today's date, or the date that you made it. That way, if anyone has any questions about that drape, everyone knows who made it and when. Now we're gonna switch views, and I'm gonna show you from this angle. So it's the same process. The two corners to the middle, you fold it, and then two corners to the middle again on the other side, fold it, and then those two corners are gonna go to the outside edge. Same on the other side. And then you're gonna fold it inwards. And then you're gonna repeat the process on the other side. As you can see, even though I'm doing like that movement with my hands so it can mark, the drape doesn't mark at all. So it just depends on which one you're using. So now you have your straight line, you fold it in half so you mark it, and you fold in half to your end point. Half again until your end point. And now you grab it from the middle to fold it. That way you have that shape that's easier to use for the surgeon. And then my coworker noticed that I was recording. That's why I'm laughing. And you fold it. This was the perfect size, as you can see, the perfect length, because I was able to put the tape with no issue. I was imitating my coworker because she didn't want to be in the video. Okay, and now I went to look for the Sharpie so we can write down surgery drape, our initials, and the date, like I mentioned before. And that's it. I hope this tutorial step-by-step guide was useful for you. Let me know if you have any questions or if you want me to show you from another angle. I'm gonna leave also a document in the description that you can download for a guide. Thank you.